All right, welcome to the September Respiratory Department meeting. We'll start off again with a brief quote reflection. This is from Paulo Cello. He says, when we strive to become better than we are, everything around us becomes better too. So the agenda today, quite a bit of things that we go over meeting after meeting. We'll go over accounting briefly, some current events, RT equipment, some things to look out for that are new, that aren't necessarily RT equipment, but equipment that we will be utilizing with nursing. A brief touch point on collaboration. Some team expectations again, a new employee satisfaction question that I'll pose to you all collectively. Education, some resources that are available. Unit-based practice council, we'll go over. I'm not sure if Danielle is on the call. I'll hand it over to her once we get to that slide. And also super exciting, something that I've been working with them on is an RT brochure that just came from the print shop today. So I'll let Danielle speak to that once we get there. Scanning scores, positions, the kudos board, and then open forum and questions. So accounting, our year-to-date productivity continues to decline. We are currently sitting at fiscal year 26 productivity of 87.4 with overtime of 1.89. From an overtime perspective, this is good. We're still hitting our marks of under 2%. But our productivity, as you guys can probably imagine, is dipping down. And it's no secret that we haven't had the patients in-house for a few weeks, maybe perhaps even a couple of months at this point. Our census for the whole house has been relatively low. And with that, only, some fraction of those patients even are on our services. So overall, well, it has been incredibly slow. It's been incredibly slow in the whole house. So with that said, there will be some changes to the staffing guide, specifically as it pertains to flexing. This is going to be worked out by me over the next few weeks. So nothing is going to be changing from what our practice is currently, but moving forward, obviously in alignment with the union contract, we're going to be looking at shaving down what our current practice has been of flexing after 6 hours down to flexing down to 4 hours. This is potentially going to be a big change. There's going to be some very clear directions about how this is going to come about. And it won't be rolled out until it is until the policy and practice is something that aligns with our policies, aligns with our needs, and has been communicated to the shift leads that ultimately are going to be the ones that are driving this. But this is obviously in response to the continued low census that we have. Obviously, flexing is nothing new for our department. This is just a change in the amount of hours moving forward. And again, to reiterate, nothing is changing as of yet. I will be working on a practice and process in the coming weeks, and what exactly that entails and how that is going to be calculated will be brought forth before it starts. So for the shift leads that are on the call, do not change any of your practices yet, just stand by. All right, current events. So Hospital Skills Fair, we got the majority of all of our staff to go through it during September. I believe we have a couple that are scheduled for the last section in November. But overall, the feedback that I got was it was a success. A lot of positive feedback insofar as that it was pared down to 1 day. Really happy to hear all of that, and thank you all for those of you that have already gone through it this year. And then our RT Skills Fair, we've already gone through 2 days. Our final day is tomorrow. I'll be sending out a reminder for the folks that have signed up to attend tomorrow's session. And yeah, that will be, again, another one in the books. So again, thank you to all those that have completed it thus far, and look forward to seeing those come in tomorrow. Some current events. As you guys probably remember, October is our kind of Fit Flu and TB clinics. This is when we start asking folks to go on their Axion Ready Set to do the questionnaires and make their elections or not. For those of you that are interested in doing our in our flu and TB clinics, those are listed on this page right here. This will all be in the DCR throughout the month of October. The expectation is that you are fit tested, and I believe that we are some staff will have to be going through PAPR training as well. But you can drop in and get your flu and TB checks during these times listed. If these times don't work for you, there are other areas where you can get this done in some of our occupational medicine suites. One looks like is in Elk Grove, one's off of Q Street in Sacramento, and then one in Prairie City in Folsom. The only thing that I would say, if you do go off-site for this, to make sure that the paperwork goes with you, and then ultimately that we turn that paperwork in to employee health if you do it off-site. If you do it here at Woodland, then you'll be fine. Okay, RT equipment. Again, this is just a reminder. You guys are continually doing a really good job, but just once a patient is either discharged or no longer needs a piece of equipment, remember to appropriately toss away the circuits, toss away the single patient use equipment, wipe down the equipment, dress it, bag it, tag it, and initial and date it. You just want to make sure that we have some accountability for the equipment that we're turning over. I think since we have enacted this new expectation of having dates and times, there have been no reports of any cleanly marked equipment that had blood stains on it. Obviously, that is we're missing the mark if we're doing that, but going upstairs and kind of auditing the equipment, it looks like we're back on track. So just please be mindful of that. It's beyond an infection prevention issue. It's just we want to have clean and tidy equipment for our patients. And this is what I was referring to with the green tags. There's Sharpies that are in the break room. Feel free to use those to mark on our green tags. This is, again, just a reminder, a repeat slide from last month to reiterate about our usage of water bottles for inhalation. These need to be marked for when we are changing them. They're only good for 24 hours. Typically, continual use on a BiPAP or a vent usually will have us draining these bottles within a 24-hour period. But if there is solution that remains, just be sure to change out that water bottle, mark it again, and only use these once they're spiked within that first 24 hours. Same thing goes for the ETADs. There has been some irises placed and some hospital-acquired pressure ulcers that had been linked to ETADs. The most recent example was a patient that actually was intubated here, transferred out to a sister facility, and then came back to our facility. So it was a rather complicated case, but just be mindful that we are marking these ETADs every 3 days. We're changing them out, and that when we do change it out, document it in the iView in free text for additional comments. This was an item that was brought up by some staff members regarding our WOWs. You guys maybe know that we recently acquired a couple new WOWs for the department, which has been great. It's allowed for everyone to have a WOW when they need it, whether that's the ICU or the floors or the ED. But just be mindful if you are taking the WOW, one of our WOWs down to the ED, to bring it back up to the second floor so we can locate it quickly for the next shift. It gets a little bit difficult kind of hunting for a needle in a haystack if the one of our WOWs is still remains down in the ED. So just please take a moment at the end of your shift when you no longer have patients or when you're handing off for report to bring that back up to the second floor. And the new practice of placing those WOWs in the alcove next to the patient waiting area has been fantastic. Please keep that up. It makes the hallways a lot more tidy. We have room in there. There are plugs in there, and it just keep it up. Gloves, PPE. Oh, before I go on, can you remind how to clean and process the new Airvo? So, Ina, that's a great question. I'll email the staff the instructions for use after this meeting. It is very similar to the Airvo 2. There are some variations, specifically some non-disposable parts that need to be washed out. There are hangers on the Airvo 3 that speak to that, but I believe I have some digital pamphlets from the manufacturer that I can send out. So I'll send that out after this meeting. RT equipment, gloves, PPE, infection control. Again, just a reminder, donning and doffing gloves appropriately as you're entering and exiting a room, doing the appropriate hand hygiene, gelling in, gelling out, or gelling in and using warm water and soap, depending on the isolation of your patient, particularly C. diff rooms. Just be mindful that we are doing this correctly and consistently. This is being audited all the time. You won't necessarily know who's watching, but there are people that are auditing all staff members, specifically, not just in regular entries to rooms, but isolated rooms as well. Collaboration. Again, this is a little hanging slide from last month. It was brought to my attention that there are instances where, say, a nurse or another healthcare staff member will make some changes to our patients without either charting those changes or informing us. Obviously, that is not ideal. We don't want our doctors going in and making changes without either charting it or notifying us, because when we then subsequently go into the room and see that there has been a change made, there is no indication of when that change was made. So I guess really, as I brought this to nursing leadership and I brought this to the director of med staffing, really the ask was, obviously that communication can be optimized better than it is, but they also ask on our end if we are making changes to titration of either high flow device, oxygen, FiO2, or flow rate, whatever the case may be, that we also are communicating that to the bedside nurse so that they are aware of what we're doing. So just, again, open collaboration from nursing to RT, from RT to nursing. It is best practice and it's what's best for our patients. Team. So again, another hanging slide. Your time card is your responsibility. Make sure that you ensure the accuracy of the punches at the end of your pay period, and to sign off that what those punches are actually reflective of the hours that you worked. Again, this is your responsibility. Generally, you guys do a good job, but just as a reminder. All right, everyone's favorite slide. Marissa, I'm looking at you. My Voice Employee Satisfaction Survey. I'm just kidding, Marissa. This is where every month I take a question that is one of the lower scoring questions in the My Voice survey to hopefully solicit some additional insight and from you all to see what it is that I can do to make things better. Sometimes these are topics that are outside of the particular facility. Sometimes they're within the facility. But either way, you know, if there's something that I can do to affect positive change, I want to know, and I'd like to hear it from you guys. So with that said, this question is, I'm proud to tell people that I work for this organization. You can tell that this is scaled out of a 5.0 max. Obviously, these scores are not too far off from the 5.0 max, but you know, I'm looking at our lowest scoring of some high scoring questions. And this is the next one that it came up. So I would hope that you would feel good about telling folks that you work for this organization, but I don't know. I want to pose this to the group. Um, is is this a accurate reflection score wise of what you collectively feel? Is there something that I could do to help promote the organization more so than I do? I guess any ideas or any commentary regarding this would be welcome. So I'll open the forum to any comments, should there be any. All right. Well, I think that's the obligatory 7-second mark. Uh, Obviously, in the open forum, I totally understand that it's a bit hard to speak up. If there is something that comes to mind as I'm talking to you guys about this and you want to message me privately, please do so. Um, I'd say that I'm proud to work for this organization. I've worked for it for quite some time. If there's anything that I could do, obviously, to make not just our department better, but to help disseminate the information that what the organization is doing at a national scale that might invigorate your excitement for working here at Common Spirit. I mean, I'm game to help in any way that I can. So with that said, we'll move on. Again, some resources that are available to you, EdAssist, that's what the company has for resources to offset the cost of education, higher education or certifications. And the Ed Fund also that's run by the union is another big chunk of resources that are available again for you all collectively to offset the cost of either certifications or higher education. I've used both of these programs pretty extensively. And if you need any help navigating it, you can either reach out to me or HR, be more than happy to help. For those of you that have some certifications, whether it's BLS, ACLS, or PALS that are coming due, there are some dates and times where we have these available here on campus. If these dates and times don't work for you, there's obviously CLC that you can register through. Pathways, they have a lot more dates and times that are available. Also for BLS, we use Cascade. They have quite a few open classes for BLS through the Cascade website as well. So if you need any help navigating any of that, please let me know. I'll be happy to assist. Unit-based practice council. So at this time, I will hand it over to Danielle.
Well, I did not know that that was done yet, the the flyer, but it is done now. So I know that you had sent it out to get to finish. But Yeah, we're gonna start handing these out to our patients. There's some stuff that we're gonna have to fill out when they're new. This will be kind of when we go and do our initial assessment with a new patient or patients that haven't gotten them yet. And we can go over them. We'll leave one in the department, I'm assuming, so we can look it over. And then I'm assuming Brian will decide when we're gonna start implementing this. I also finished our rough draft of our RT treatment protocol. And so Brian's going to look that over and then eventually Dr. Robinson. But if anybody else wants to have any input in it or read it, just let me know and we can print out a copy and you guys can read it. It's 17 pages long, so it's very long, but it's gonna help us out in the long run. It'll be a little more work in the beginning just because it's gonna be, new processes to do when we go see patients, but eventually it'll just be part of our regular routine. So
Hi Danielle, this is Kara. I'm just jumping on. Are you talking about what's going to be 17 pages, just out of curiosity?
this is our new, eventually new RT treatment protocol.
What I'm looking at right now? Because it looks like
No, this is a
right, that's a
flyer.
one-page
So
flyer. Gotcha. I was like,
yeah.
that didn't look like 17 pages.
Yeah, no, this is a flyer that we're going to be handing out to patients about their treatments
Yeah, no, I
and what.
like it. Yeah.
Yeah, and then the RT treatment protocol is much longer. It's because we don't have one as of right now. A lot of the other hospitals do. So what I did was just kind of look over a couple of the other hospitals and kind of made it our own and just made one that pertains more to our hospital. And then now Brian's gonna look that over and then we'll go from there.
Oh, that's great. No, thank you for the
Yeah.
clarification. I didn't think that looked like 17 pages.
Yeah.
Inspired me.
I
All
don't
right,
think our
sorry, I'm
patients would
just
want
kind of
to read
jumping on. Yeah,
that.
Hey,
right.
Kara.
Looks
Yeah,
great.
this is again the brainchild of the Unit-Based Practice Council. We had one of these, I believe, many, many, many years ago. It predated me. So it was brought to my attention. I reached out, obviously, to Danielle and Carrie to make some revisions to it. It just came in through the print shop last night. And they are actually, to Danielle's point, this has been the pamphlets have been put out in the department, and it's already been expressed to have them go out to the patients that we have interactions with. So very good work. Super proud of it. It looks great. Oh,
Thank you.
yeah. Okay. Moving on. Scanning scores, again, this is something that I audit daily, and you guys consistently do a really good job. So this is just a reminder, make sure that we're scanning the right med for the right patient at the right time. It's a national patient safety goal, has been a national patient safety goal. If you come across a WOW that has a malfunctioning scanner, take the time to get a different WOW to administer the medication and put in a ticket for that WOW. Ultimately, the only way that we're going to consistently have functional equipment is if that equipment is tagged that it needs to be fixed. So again, just a reminder, and again, you guys do a really good job on scanning, so keep up the good work. There is one thing that kind of is tangentially related to scanning and medication administration. This was something that had been brought to my attention by Ryan Fedrizzi. If you don't know that name, he is our director of pharmacy here at Woodland. And he's actually phenomenal at what he does. He's been really tightening processes and procedures within the pharmacy to make things better for frontline staff, nursing and respiratory alike. But some of the reports that he had pulled had indicated that there were discrepancies, specifically in the ED Omnicell, as it pertains to respiratory medications. In other words, the amount of medications that were delivered or should have been in the bins in the Omnicell in ED were different than what their actual account of the number was for those bins. So in other words, say they put in 50 single pouches of albuterol. And when they do the report from how many that the machine says that they has been pulled, there was a discrepancy from what the machine said to what was actually there. So I know that when we're given continuous breathing treatments, we're typically pulling several single vials at once in order to facilitate the amount of milligrams for whatever order it is that is placed. And it's totally fine that you grab more than one at a time, but there you do have to go in and make the accurate account of how many you're taking at a time so that we have a good idea of what is in there at any given time. This has to do with par levels. This has to do with restocking. Because what they go off of, the pharmacy techs and pharmacists, is how many that the machine says that it has. That's kind of what drives them to refill those bins. So these are some tips and tricks that I actually got from pharmacy to help us better navigate when we need to take multiple meds at once for one particular patient so that we are in alignment. And then when they audit it, there's going to be an accurate reflection of how many the machine says there has versus how many there actually are in the bin. So if you're looking on a camera phone as you're on this meeting, you can't really see these directions. I will be emailing this out and putting it in our Tiger Connect chat. But essentially, it is once you log into the Omnicell, you get the patient that you're interested in, you're removing items. You search for the medication, you find the medication, you enter the quantity that you're wanting to remove, you confirm it, and then you go through the regular prompts subsequently. This is just an additional step that I believe hasn't been followed previously. And, this is not something that I had taught to previously either. But I think this is going to go a long way to make sure that we have accuracy between what is reported in the Omnicells with what the reality is that are in those bins. So this information will be going out to everyone after this meeting as well. Positions, we have all positions filled. Our last position is Luda. She will be at CLC on September 29th and 30th, and she will be on site the 1st of October. So when she arrives, you may remember she was a former student. She'll be coming to fill one of our full-time night shift positions, but she'll be training on days for some time. So please give her a warm welcome when she arrives. Kudos. So the Kudo board, again, extremely sweet. Thank you very much for the kudos for the North Star Award. I very grateful to have been recognized, and thank you for calling it out as it was mentioned in our insights. I'll try to live up to that, to those accolades. Kudos to Elvis for taking great care of a pediatric patient in the ER on high flow, and kudos to Patrick for being a team player. He's one of our new RTs. So very good stuff. So that was a lot. There's a lot that was discussed today. I do have some IOUs for everyone in the department, including those that are on the call, regarding the cleaning of the Airvo 3s, as well as the tips and tricks for the Omnicells. But beyond that, anybody that's on the call, questions, comments, concerns?
And that can be for me too.
Yes.
I know there's concerns about census. I do know that there's new physicians who are coming on board. We have 2 new GI docs, looking at urology. We have some meetings coming up. OBHG, I think you guys might see that the census is coming up a little bit with the babes. So we should hit 30 this month. Xana's getting a report now that kind of predicts how many births we're having. So we did partner with a group. I believe there's 4 new physicians as far as OB goes. What else can I tell you? I've been talking to other hospitals that I used to work for, et cetera, and we're all kind of seeing a lower census. So it's kind of interesting now that we're starting to move into the fall. So either it's the calm before the storm and we're a little delayed, or so just be kind of watching for that. But know that we are aware and we're watching census too, of course, and working with the clinic across the street. Open enrollment hopefully will help too. Mhm.
That's coming up.
Yeah.
All right, you guys. Well, thank you again for your attention and your time. And I'll see you all very soon. Have a good day.
Good job.